Welcome to the Virtual Reality Clinical Case Study. The objectives of the Virtual Reality Case Study are the following. 1. Ask permission and elicit the patient and family members' understanding of the patient's condition. 2. Utilize communication tools during the conversation of goals of care. 3. Engage the patient and the family in goals of care conversation. 4. Perform an advanced care planning conversation. And 5. Guide the conversation in a compassionate manner. Now you will be presented with 4 scenes regarding palliative care communication in the perspective of a bedside registered nurse in the hospital during the nurse's shift. Before you get started, let me give you some background information on this patient. This is an 80-year-old male coming from home with a history of chronic respiratory failure who is oxygen dependent, has COPD, mild dementia, depression, hyperlipidemia, hypertension, who was brought in by ambulance to the emergency department 4 days ago with reports of having altered mental status and being less responsive to his daughter. The patient was discharged home 2 weeks ago after being readmitted for pneumonia from chronic hypercapnic respiratory failure due to his COPD. He was stabilized in the hospital and was discharged home with 2 liters of nasal cannula that he has been on for several years. According to his daughter, he did well on discharge. However, his condition declined over the weekend, and he became more lethargic and was found less responsive. So his daughter called the ambulance and he was taken to the emergency department. In the emergency department, his PCO2 was 100 on ABG. He was placed on continuous BiPAP, and since then his mental status has slightly improved. He was admitted to the ICU and was treated with IV prednisone and breathing treatments. After 4 days in the ICU, the patient improved with O2 saturation in the low 90s, with BiPAP PRN on 4 liters nasal cannula. Currently on a total of 40 milligrams PO of prednisone. He was transferred to the respiratory unit last night. He is alert and oriented ×3, and he can respond to simple questions.
Hi, good morning.
Good morning.
Hi, my name is Ashley. I'm going to be your nurse today. I'll be here till about 7. Mr. Rodriguez,
Yeah.
how are you doing?
So.
Not so good?
Doesn't good.
Are you his daughter?
Yes, I am.
Hi, give me your name.
Libby.
Libby, nice to meet you. I don't know if you remember me, Mr. Rodriguez. I was here with you a couple weeks ago.
Yeah, independent.
You remember me? Yeah. How are you feeling today?
So.
Yeah. I see you took off the mask. Was it uncomfortable?
Not comfortable though.
Okay. I understand that it can be very uncomfortable for patients who have to wear, but it's something that we need to keep on because it's part of his medical treatment to make sure that we're improving his breathing in addition to all the other treatments that we're doing. I'm going to go ahead and just start my assessment. Is that okay? Is it okay if I listen to your heart and lungs first?
Yeah.
Okay. Can you take a deep breath? ¿Puedes respirar profundamente? Muy bien. ¿Otra vez? Good. Okay. Well, it doesn't sound like you have any crackles or any wheezing, but he's not moving a lot of air. It does look like his sats are in the low 90s, which is where we want him to be. Hopefully, once he's completed the treatment, he won't need the mask as much anymore. But we'll have to assess from there. Ojalá cuando completamos el tratamiento no va a necesitar la mascarilla tanto. Y en eso puede nomás usar el oxígeno que tiene puesto.
Está bien.
¿Ha notado que esta es la tercera vez que ha estado aquí con nosotros?
Sí.
I know this is the 3rd time that he's been in the hospital here with us. How do you feel about that? ¿Cómo se siente que es la tercera vez que está aquí en el hospital?
Muy bien.
Yeah.
Yeah.
So I understand it can be frustrating to have to be in and out of the hospital. I wonder if you've heard of palliative care? Is it okay if I talk to you a little bit about palliative care?
Yes,
Yeah. So palliative care is a medical team that works with your doctors, and they work with patients who have severe illnesses. And they see their goal is to provide a lot of benefits that may improve quality of life. If you guys are interested, I can see if we can make arrangements for them to come speak to you.
We'd appreciate that.
Would that be okay? ¿Está bien si agarramos el equipo de Palliative Care para que hablen con ustedes?
Sí.
Muy bien. Okay, so I'm gonna just have to go see my other patients, and then I'll be back in about an hour. So tengo que ir a ver los otros pacientes y voy a regresar en más o menos de como una hora.
Okay.
Si necesita algo, me puede nomás oprimir el botón. So if you need anything, just use the call light. Y regreso en un ratito.
Está bien, sí.
Thank you. Thank you.
Okay.
Hi, Miss Christina, how are you doing? Good. You look really good. You're almost ready to go home. I think you can go home tomorrow. Okay? I'm going to let the nurse know so they can get your discharge process ready. Okay? All right, good. Do you have any questions for me? No? Okay, great. I'll be back in a while, okay? And just make sure that everything is okay with you. All right? All right. Hello.
Hi, Dr. Matthews. This is Ashley calling from 5 West.
Okay, how are you?
I'm doing good. I'm calling you regarding our patient here, Mr. Rodriguez.
Mr. Rodriguez? Is that the new patient? I just came back from my 1 week off. I never heard of his name.
Yeah, no worries. Let me just fill you in about him. So he's an 80-year-old male admitted for COPD exacerbation. He was in the ICU for 4 days and just transferred to us last night. He has been stable. He's been treated with breathing treatments, oral prednisone, currently on his 5th day. He's been using the BiPAP as needed, but currently using 4 liters nasal cannula.
How many liters?
4 liters.
4 liters, okay.
Yes. His O2 sats have been running around the low 90s. He has a long-standing history of COPD with a 20-year PAC history. He came in from home but has had multiple exacerbations and thus multiple admissions for his COPD this year. Yeah, this is actually his 3rd admission.
3rd admission? When was the last time you was here in the hospital?
The last admission, I believe, was about 2 weeks ago.
2 weeks ago? He came back so soon.
He did. He also has a history of dementia, hypertension, and depression. And he currently has been living with his daughter, but I believe she's had a really hard time managing him. So I'm concerned that because of his frequent readmissions, his inability to control his respiratory symptoms, and he doesn't really have very clear goals of care, I think that he actually would benefit from a palliative care consult. I was wondering if you thought that this might be appropriate for him.
Yeah, actually, when I was listening to your report, that's what I was thinking. Thank you. I'm going to go stop by his room soon, and I'll get back to you. I may consider ordering palliative care consultation.
Okay,
Thank you
sounds
so much.
great. Thank you. Bye.
Hello, I'm back. Hi, did Dr. Matthews come talk to you all about palliative care?
Yes, she had stopped by earlier and said that she had ordered a palliative care consult, and but we're not really quite sure what that is. So if you could explain that to us a little bit more in detail, we'd appreciate it.
Yeah, of course. I'm just going to go ahead and close the door to provide a little bit quieter space here to do so. Do you have anyone else who would like to be part of this conversation and explain about palliative care a little more?
No, it's just my father and myself.
Okay, great. Well, palliative care is a special team here at the hospital who works with patients who have serious illnesses, such as COPD, like your dad. And their goal is to help families and patients in decision making. They will meet with your dad's doctors and they'll get to learn his conditions and be able to meet with you and explain that condition as well as treatment options in an easy way to understand. They'll also meet individually with yourself, with your dad, to understand what's important for him, what at this stage in his life, and what his goals are for future care. Is that something that you guys would be interested in, or does that make sense?
Yeah, we definitely want to learn some more about that.
Okay, great. To help to little understanding in terms of how you understand your dad, could you explain to me what you understand about his current condition?
Yeah, lately he's been actually deteriorating as far as his everyday living. His breathing's been getting a little bit more difficult. His dementia's getting worse. His daily activity, as far as getting dressed, it's not as easy as it used to be, and I just don't know what to do at this point.
Yeah, I understand it's definitely very frustrating and very scary. I mean, as I mentioned earlier, I saw him a few weeks ago when he was here, and I can definitely tell in his breathing that his health has deteriorated in that short amount of time. So, I understand it's very scary, and I am very sorry about that.
I'm getting, a little scared and just don't know what to do at this point.
Yeah. Oh, would it be okay if I share my opinion with you as far as being his nurse?
Yes, please. We'd appreciate that.
Yeah. Well, I with as Dr. Matthews mentioned, I would happen to agree that this would be a good time to reflect on what his goals are for his medical care, and also to think about and what he would want if he would not to recover as he has before, and if he would not be able to return home.
Is that hospice?
So palliative care can often gets confused with hospice, and although there are some similarities, there are some differences. Hospice focuses on patients who are at end of life. At those patients have chosen not to continue with curative treatment and are more looking to spend the end of their days in a comfortable place such as home and not in a hospital. Palliative care works with patients on all ends of the spectrum of a chronic disease, whether it be, or a serious illness, whether it be at the beginning of diagnosis or whether this person's been handling the disease for many years. So they can work with patients who are in hospice, but again, they can work with anyone else at any point of a serious illness. So their goals again is to just get a better understanding of what the patient would or would not want, in terms of focusing on treatment and goals now and treatment goals in the future.
Okay, that makes sense. So that would be something that we would like to actually check into and see if that was something that would help us.
Perfect, great. So I believe they'll be in later on today, or maybe early tomorrow if they don't get a chance today. But I will be here for the rest of the shift till about 7. So if you think of any other questions, go ahead and let me know.
Okay, perfect.
Okay.
Thank you very
You're
much.
welcome.
Thank you, Papa.
So I noticed on the admission documentation that did not complete some questions. Is it okay if I review one of the questions with you both?
Yeah.
Yes.
Sure.
Okay. So one of the questions is asking if you have an advance directive. Do you have an advance directive?
I've heard other nurses mention that,
Mm-hmm.
but we're not actually quite sure exactly what that is.
Okay. Would you like me to explain it to you?
Yes, please. Yes, Papa? Yes?
Yes. Okay. So an advance directive is a legal document you complete to make sure you get all the health care you want. In the legal documentation, you choose someone, we call them a healthcare agent, to make decisions for you in case you can't communicate for yourself. It's also important to have, in case you come to the hospital and you don't have your healthcare agent with you, this document helps the medical team direct your treatment and have that treatment be according to your will or according to what you would or would not want. So every adult should have an advance directive. But it's especially important for those who have serious illnesses. So I'm going to go through a couple parts. The first one talks about choosing a decision maker or choosing a durable power of attorney for healthcare. So if you're unable to make decisions for yourself, your healthcare agent will be able to decide which medical treatments and procedures you do or do not receive, including artificial life support. That agent will choose what healthcare providers and facilities are involved, They'll be able to see your medical records as well as receive information about your current medical status. They'll be able to work with healthcare insurance companies and other healthcare programs on your behalf, as well as direct the disposition of your remains after you were to pass. So here you can designate who you want that person to be, as well as you can list a first alternative. So if Libby here, if for some reason is unable to speak for your behalf, you can list someone else. It could be another family member, another friend, someone who you trust, to basically carry out your decisions. The second part is regarding artificial life support. So if you are seriously ill, and most doctors will offer artificial life support. This can include things like a ventilator or a breathing machine. It can include artificial nutrition, which involves a feeding tube, but it can also involve other medications or machines that will keep you alive past the point of which you would have died naturally. So artificial life support gives other treatments time to work, but artificial life support in and in itself doesn't help you get better by itself. So here you can designate to what extent you would want. So for example, the options include if you're so sick and you need artificial life support, one option would be to keep you alive as long as possible, even if you have little chance of recovering for yourself. So knowing they're going to continue doing that. Or receiving artificial life support only if you had a good chance of recovering. So kind of giving the doctors time to treat you, but then allowing that if the doctors felt that you did not have a good chance of recovery, allowing the focus to stop on treatment and make you more comfortable. A third option would be never wanting any artificial life support. So if you became so sick that you needed it but did not want it, that would be something you can choose as well. Lastly, you can also leave it up to your healthcare representative. If you feel you've had that conversation well enough and she can make the decision for you based on what you would want, then you can completely leave it up to her. The rest of the form covers other things such as what matters to you in terms of quality and care, but you guys can go through this later. One thing I did want to mention is that to complete it and to make it legal, it does need to be witnessed or notarized. So you would need 2 witnesses, one of whom could not be your healthcare agent. It couldn't be a physician, it couldn't be a nurse, it would just have to be an independent person. Or you can get a notary. So going into a notary and have them notarize it, that would make it legal. You would want to always have a copy with you. So if you came into the hospital, making sure you have a copy with you so that they have it in their documentation. Always making sure family has a copy, as well as your primary care provider or any specialties that take care of you so that they are all aware of what your goals are. And most importantly as well, always having that conversation. It doesn't mean because you've said this here and legalized it that you can't change your mind. You can always do a new documentation, and the last one dated always supersedes previous ones. So I will leave this here with you. You guys can have time to look over it. There's not necessarily a deadline. Of course, we just advise you guys have time to actually discuss it and fill out that form.
Okay.
All right, and then let me know if you guys have any questions.
Okay.
Okay.
So right now we're good. Okay, we'll discuss this. Okay. Okay. Thank you.
This concludes the virtual reality case study. A special thank you to Dr. King and Dalton Salvo for recording and editing this virtual reality experience.